I'm Peg Bull-Joni, Communications Specialist with Rutland Regional Medical Center, and I'd like to welcome you to Window on Wellness. We're pleased to have Traci Moore, Director of the Rutland Health Foundation, and Parrish Smith, Breast Care Navigator with the Breast Care Program at Rutland Regional Medical Center, as our guests. I will be back with Traci and Parrish after this message from Rutland Regional Medical Center.
I'm Tom Hubner, President of the Rutland Regional Medical Center. The Rutland Regional Medical Center is the largest community hospital in Vermont. We started back in 1896. We had 16 beds, 8 physicians, 1 nurse. This past year, we took care of nearly 250,000 patients, and we have 1,600 staff, 258 doctors. We are here to serve our community in every new way that is possible with this promise to you. We listen, we respect, we care, always.
Welcome back to our program. I'm very pleased to have as our guest today on Window on Wellness, Traci Moore, who is the Director of the Rutland Health Foundation. And with her is Parrish Smith, who is the Breast Care Navigator in the Breast Care Program at Rutland Regional Medical Center. Welcome, ladies.
Hi, thank you for having us.
Yes, well, it's a pleasure. And so the show is yours today. We've got a lot of great things to talk about. And I think the buzzword is Pink the Rink. Right, Traci?
It sure is, Peg. Yes, really excited to have the chance to talk a little bit about Pink the Rink, and especially this year's Pink the Rink, which represents 10 years of this very special event and this partnership between Castleton University Women's Ice Hockey Team and Rutland Regional Medical Center.
So how did Pink the Rink begin? Give us a little bit of history on it.
Sure. So again, great partnership with Castleton University over the years on a variety of different things, but Pink the Rink really was born out of the women's hockey team's desire to do something around breast care awareness. They wanted to host a game each year which would help to raise funds and awareness around breast cancer, early detection, and the importance of regular mammograms. So they started in 2008 to build what has become an annual game, well attended, and really a celebration of the strides that continue to be made in the areas of breast cancer and breast cancer awareness.
No, I think I was fortunate enough to go last year, and it was my first time, and I was very impressed just how it all kind of unfolded. And there was so much energy and so much love in the air. I mean, people were, you can just feel the commitment was palpable. It really was, of everybody that participated. So how much money has Pink the Rink raised for the last 10 years?
So over the course of the last 9 years, Pink the Rink has helped to raise close to $60,000 in support of the Foley Cancer Center and the Breast Care Program at Rutland Regional.
Wow, that's very impressive. So it's scheduled, it's coming up, the game, so why don't you tell us a little bit about that?
Sure. So on Friday, January 26th, Castleton University Women's Ice Hockey Team will host Salve Regina at Spartan Arena. It's a 7 o'clock game. Entrance into the game is the typical $7 per person, $4 for seniors, and $2 for student attendees. The goal is really to not only pink the rink, but fill the rink with fans to cheer on Castleton University and really, again, create some awareness around the importance of breast care, breast cancer prevention.
And are people encouraged to wear pink that night?
They sure are, yes. We're hoping to fill the stands with pink. We have a number of breast cancer survivors that attend the event each year. They always come in pink. We have staff from the hospital, Parrish and her team from the breast care program, the folks from the Foley Cancer Center, physicians and staff, all come decked out in pink, and many, many other fans do as well.
So let's talk about that evening. What is going to be happening? How will things kind of unfold?
So there's a lot that happens. Again, the game starts at 7 o'clock. There are a variety of different sales and raffles. The Castleton Booster Club puts a lot of time and effort into the Pink the Rink event. They create a basket raffle. There are oftentimes between 20 and 25 different baskets that fans can choose from. All of the proceeds raised from the basket raffle come back to the Foley Cancer Center and the breast care program, as well as the entrance fee at the door. There's a bake sale. There's a lot of different food there. The Castleton University Marching Band will be on hand to keep things lively and festive. The game has always started with an official puck drop, and this year Rutland Regional's President Tom Hubner will officially drop the puck to start the game.
Oh, that's great. So what other partners are involved with Pink the Rink besides Castleton and the hospital?
So really, the Castleton community puts a lot of time and effort into organizing this event. So again, the Booster Club, the athletic department, the parents, the families of the players really invest a lot of time and resource into making Pink the Rink the event that it has become. The community, we have a lot of youth hockey teams that are in attendance at the game. The Spartan Arena folks really put a lot of time and effort into making this all happen. And of course, our staff at Rutland Regional, the breast care program, the Foley Cancer Center, this has really become an important event over the years and something that we all look forward to.
Are there any surprises for this year? Well, I guess if you told me, it would be a surprise.
So what
Anything special?
What I can say, Peg, is there are a lot of special things being planned for this year's 10th anniversary event. A lot of the partners that we've discussed are kind of reaching back into their archives to pull out some special memories, special moments of games past, and really working hard to make this a fun celebration of the efforts that Castleton University has put forth for Pink the Rink, and again, the awareness that's created around the importance of regular breast care, early prevention.
And I know that the money that is going to be raised is going to go, is it going to go towards the new technology, the 3D breast imaging, or?
It's not. Actually, the money that's raised each year really supports the breast care program and different initiatives that it does throughout the year, internally within the hospital, externally in the community. Again, like the Foley Cancer Center, the breast care program works with cancer survivors, provides different informational and support groups, and that money is well utilized in those ways.
Well, I think we have to fill the rink, right?
Yes.
We have to fill the rink. So there's going to be a lot of advertisement, a lot of promotion done in advance to get people excited about this. I know Castleton is going to be doing their part in trying to get folks to pack the rink, so to speak. And so we just want to make sure, and if folks want to buy tickets, do they buy them in advance or do they buy them that night at the door?
They buy them that night at the door.
Okay.
Yes.
All right.
There is information on the Castleton University website about Pink the Rink.
Okay.
There is information each year. The team creates a special jersey that they wear in honor of Pink the Rink.
That's right, it's right here.
This year's is extra special in honor of the 10th anniversary. The team actually organizes an online auction, so folks have the opportunity to go online and bid on the jerseys. They can customize a jersey, they can order their own. All of that information is there on the Castleton University website.
Okay, and you've got a flyer there.
Yes.
Maybe you want to just kind of prop it up
Sure.
and so our audience can kind of see and look for that particular flyer. That's going to be all over the place. I know it's on our Facebook page.
Yeah.
It'll be on Castleton University's Facebook page and newspaper and PEG TV, a lot of different venues.
So the Rutland region should be looking for plenty of pink over the next couple of weeks. We will take the opportunity to promote the game and to really celebrate and thank Castleton University, the women's ice hockey team, the coaches, the players, the parents, for their efforts in making this great event happen for 10 years now. And I think this game on January 26th will really be extra special. So we're hoping many folks will come out from our community in support of the game, the team, and our breast care program.
All right, well said, Traci. And I think this is probably a good segue to maybe redirect the conversation a little bit to the 3D breast imaging technology that is going to be coming to Rutland Regional. And Traci, I think you had some good news to share with the community about that, or?
Thank you, Peg. Yes, we actually have some very good news to share this week. Rutland Regional will be announcing the fact that we recently raised $362,000 toward the purchase of a new 3D breast imaging machine. The hospital is investing in 2 machines. In late spring, the Rutland Health Foundation took responsibility for raising $350,000 to cover the cost of 1 new unit. With wide support from the greater Rutland community, we are very happy to report that we exceeded that goal slightly with $362,000 raised.
Wow, that's incredible. That is. I mean, look at the smiles on you two. That's just amazing. Rutland is a very generous community. It has a big heart, and so that's really gratifying to hear. And I'm glad that we were able to share this good news on Window on Wellness. So Parrish, let's talk about the 3D breast imaging technology. Can you maybe describe a little bit about what it is, and so people will understand it better?
Sure. So it's more advanced imaging technology than what we currently use. In a way, I describe it to patients and their families to better explain the difference is the traditional mammography that we're using right now. It's the equivalent of standing at the edge of a forest and looking in and looking for a bird in a tree. Okay.
Oh, all right.
With the new equipment, it's really going to be like you're in the forest, walking around the tree, looking for the bird in the tree. So it's a totally different image. They're going to see it in 3 dimensions. So the hope is that this is improved imaging. We will be able to pick up cancers earlier, but also reduce the number of what we call false positive callbacks. So women that we see a little change and we recommend they come back in and everything's fine. So we hope to reduce that, because that alone can be very anxiety producing for patients.
Oh, I'm sure. And so, I mean, so you kind of explained the benefit about this, and will this encourage, you think this will encourage more women to get regular mammograms, or?
Certainly that is the hope, that this new technology will encourage women to come out. I think most women in the community that I've spoken with are very excited about this and having this available here at our local community hospital in Rutland.
No, I think it's great because women won't have to travel. And I know this is a very special, advanced type of technology. Is the radiation any different?
So it's decreased radiation compared to what we currently use. And I know that the team at Rutland was very mindful when 3D technology first came out. They really wanted to wait until the technology advanced a bit and that radiation exposure was reduced.
Does this make the mammogram more comfortable, or is it still the same process?
So it's still a little uncomfortable, but it should be slightly more comfortable than it is currently.
Okay. And I guess, you know, this is I know that women have to travel. I think Dartmouth has it, UVM has it. So I think this will be a great advantage, you know, for our community for this.
I think so. We're all very excited, and we're so appreciative to the support from the community to be able to raise the funds to get this new equipment.
So let's talk a little bit about the breast care program at Rutland Regional. Maybe we might want to enlighten our viewers about, you know, what it is, what you do, you know, how you work with patients that are facing, you know, these types of issues.
Sure.
So the floor is yours.
All right. Well, I'm a physician assistant, and so I'm in the breast care navigator role. And really, my goal is to be a resource for education for patients, but also to help coordinate care. So myself and our breast care nurse, Samantha, are available to talk with patients at any time if they have questions. But we really get pulled into the loop when there's some type of abnormality seen on imaging. So we then call the patient to discuss that, what that means, what the recommendation is, and then we really try to help guide the patient through their next steps, whether that be more imaging, potential biopsy, or referral to a different provider to move on to the next steps.
Well, that must kind of assuage some of the anxiety, you know, for the women that are facing this. I mean, it's not just a straight, you know, conversation with the doctor or the, you know, technician. You know, it's nice to have you as that kind of in-between piece, you know.
It's wonderful, and really our goal is just to be there as a resource and support for the patient as they navigate through this.
Do you work with the patients after they've been diagnosed with breast cancer?
We do. So we try and sort of transition that patient to the cancer center if they choose to get their treatment here at Rutland until they're established with that group, but we're available throughout the process for the patient from start to finish.
I mean, do you see the mortality rate increasing for breast cancer?
Well, we know that early detection saves lives, right? So the biggest thing is we want to encourage women to come in annually to get their mammogram, which is what we recommend. And so the earlier cancer is detected, the better outcome for the patient.
How do events like Pink the Rink help to promote the importance of regular mammograms and early detection?
Well, I think in the general sense it raises support for the breast care program and the cancer center and the hospital, but it's also a reminder to women that they need to be coming in and getting their screening mammograms, but also just getting the word out. It's also a reminder for friends and family members of women that fall into the age group where they should be getting in. Just a reminder that you really need to come in.
Why would women be reluctant to have a mammogram? Are they just afraid of the outcome, or?
I find that most women delay getting them because they're concerned about the outcome. They'd rather not know if there's something going on. And I really try and talk patients through that the best thing we can do is catch things early and start treating them before they progress. So I really try and encourage women to come in, and I've found that women that come in together, so sometimes women will have a group of friends and they'll all say, okay, January is going to be our mammogram month, or family members, so come in together if that's more helpful.
Are there support groups available at the hospital for women that have undergone breast cancer treatments or, you know, had this disease?
There is a support group for women called Women to Women, and it's for any woman that has faced cancer, so not just breast cancer, but it's a wonderful group of ladies. They do activities in the community. They come to a lot of our events. So they're a great group.
Yeah, so they'll be present at Pink the Rink, I imagine.
Yes, they will.
That's good to know. I know that, and I guess I'm curious about this statistic, and I'm not sure if you can speak to this or not, but are the majority of those that are diagnosed with breast cancer, is it ones without a family history? I've heard more about that lately, so I didn't know if you could speak to that.
Sure. So it can be a little confusing. Certainly having a strong family history of breast cancer we know can increase someone's risk. However, most women that are diagnosed with breast cancer do not have a family history.
That is so puzzling to me.
Yep.
And I mean, and what are things that you recommend if a woman had like a false alarm, okay, and everything turned out to be okay? What do you recommend any type of changes in their lifestyle, diet, anything like that? So
certainly the healthier an individual is, that reduces their risk of cancer. And so we know that leading a healthy lifestyle, exercising regularly, having a healthy diet, maintaining a healthy weight, trying to limit activities that we know can be harmful, such as excessive alcohol or tobacco use. So those are all things that women can do to try and reduce their risk.
And so what is, I'm just curious about the survival rate now for women that have been diagnosed. How does that look right now at this point?
So there are advances being made all the time. I can't give a specific number.
Right.
A lot of that depends on the type of cancer a woman's diagnosed with, but they're making advances all the time. And no matter what type of cancer it may be within the breast, the earlier it's detected, the better for the patient.
But you just deal with the breast care piece, not women that are dealing with other types of cancer.
Correct.
Okay. Correct. Is this the first time Rutland Regional has had a breast care navigator, or have they had it all along?
No, they've had it for quite some time. What is unique is that typically a navigator is a nurse or a social worker, and I'm a physician assistant, so that is a little bit unique, and so we're trying to sort of transition the program a little bit. So I've been with the program for about a year.
Okay. All right. And so Traci, is there anything that you wanted to speak to about the 3D breast imaging technology or Pink the Rink?
Well, again, it's just really nice, Peg, to have the opportunity to talk about Pink the Rink and promote it so that our viewers, any of those fans who are out there, fans of Castleton women's hockey, if you love to watch hockey, this is a great game to attend. In addition to the game, there will be a variety of different raffles, giveaways. We talked about the basket raffle, just the fun atmosphere that will be created that night. And again, just to really say thank you to our local community for the time, support, and resources that have been donated to the Early Detection Saves Lives in support of bringing this new 3D breast imaging technology to Rutland Regional Medical Center and our local region. As you said, this is a very giving, very generous community, and we are so grateful for that help and support in making this happen.
Well, I mean, we'll certainly do our best to promote it because it's definitely a worthwhile event, and we have such a close relationship with Castleton on so many different levels. I mean, they really are part of the Rutland community, which just makes it that more important for people to get out there and support it. So, and and they do a great job. I watched the game last year, and it was exciting. Hockey's very exciting, and Rutland is a big hockey town, just like they're a big football town.
Yes.
So we just want to encourage as many people to come as possible. We want to pack that rink. So we want to raise a lot of money to support the breast care program at Rutland Regional, and all the great work that you both are doing. So I want to thank you for being on Window on Wellness. It was a pleasure.
Thank
and
you.
I did want to say before we close out that we have a quick segment of a Castleton women's hockey player doing a little of her own promotion of Pink the Rink.
Hey Spartan fans, see you at Spartan Arena for our 10th annual Pink the Rink game on January 26th.
I'm Jeff Wallen. I live in Brandon. I have an artificial hip and I love to play tennis. In August of 2013, I had the misfortune of an accidental fall in my home where I thought I had just bruised my hip, but I could walk quite well and didn't think anything of it until 4 days later, after flying to the state of Minnesota to attend a wedding. One morning, Saturday of that week, I tried to get up and I could not move my leg. And every time I'd try to walk, my leg would not move forward, it would just shift up vertically. So I knew I was in trouble. After buying a pair of crutches, I made my way to the St. Cloud Hospital emergency room, where the folks were quite excited with what they found. It seems that it's very rare for a ceramic ball, which is part of a prosthesis for a hip replacement, had totally shattered. They provided me with x-rays of it, were quite disappointed when I told them that no, I would try and make myself back to Rutland to have the repairs done. The processing, corrective surgery, and recovery with physical and occupational therapy was seamless and harmonic. And to have experienced such professional and comprehensive planning and execution was eye-opening. We are so fortunate to have such a facility as the Rutland Regional Medical Center in this area that could perform and pull off such a procedure with such teamwork and coordination that let me continue doing the things in life that I really enjoy doing. Thank you, RRMC.
Rutland Regional Medical Center. We listen, we respect, we care, always. That's our promise to you.